Understanding the silent killer. Malaria and its impact. Malaria is a serious disease. It can even be fatal. This disease is caused by a parasite. The parasite is called Plasmodium. Malaria affects millions of people around the world each year. It is particularly prevalent in tropical and subtropical regions. These regions provide ideal breeding grounds for mosquitoes. Mosquitoes transmit the parasite. Malaria is a major public health concern. This is especially true in low-income countries. The disease can have devastating effects on individuals, families, and communities. The economic burden of malaria is also significant. It can hinder economic growth and development. Despite the challenges, there is hope. Global efforts to control and eliminate malaria have made significant progress in recent years. Through research, innovation, and public health interventions, we are getting closer to a world free from malaria. But we must remain vigilant. We must continue to invest in research. We must strengthen healthcare systems, and we must support affected communities. By understanding malaria and supporting efforts to combat it, we can make a difference. We can save lives, and we can create a healthier and more prosperous future for all. The tiny enemy. Plasmodium parasites and their life cycle. Malaria is caused by a tiny parasite. This parasite is called Plasmodium. There are several species of Plasmodium parasites. 5 of these species are known to infect humans. The life cycle of the Plasmodium parasite is complex. It involves 2 hosts, humans and mosquitoes. When an infected mosquito bites a human, the parasite enters the bloodstream. The parasite then travels to the liver. In the liver, it multiplies. After multiplying, the parasite is released back into the bloodstream. Once back in the bloodstream, the parasite infects red blood cells. Inside the red blood cells, the parasite continues to multiply. This causes the red blood cells to burst. The bursting of the red blood cells releases more parasites into the bloodstream. This cycle of infection, multiplication, and cell bursting is responsible for the symptoms of malaria. Understanding the life cycle of the Plasmodium parasite is crucial. It helps us develop effective strategies to prevent and treat malaria. By targeting different stages of the parasite's life cycle, we can interrupt its transmission and reduce the burden of this deadly disease. The bite that brings disease, transmission of malaria through mosquitoes. Malaria is transmitted through the bite of an infected mosquito, but not all mosquitoes can transmit malaria. Only female mosquitoes of the Anopheles genus are capable of spreading the parasite. When an infected Anopheles mosquito bites a person, it injects saliva into the skin. This saliva contains Plasmodium parasites. The parasites then enter the person's bloodstream and begin their life cycle. Anopheles mosquitoes thrive in warm, humid climates. They breed in stagnant water sources. These sources include ponds, puddles, and ditches. The mosquitoes are most active at night. That's when they bite humans and transmit the parasite. Understanding the transmission cycle of malaria is crucial. It allows us to develop effective prevention strategies. By targeting mosquito breeding sites, using mosquito nets, and applying insect repellents, we can significantly reduce the risk of malaria transmission. Section 4. Fever's grip. Recognizing the symptoms of malaria. Malaria symptoms typically appear within a few weeks after being bitten by an infected mosquito. However, in some cases, symptoms may not appear for several months. The initial symptoms of malaria are often flu-like. Common symptoms include high fever, chills, sweating, headache, muscle aches, fatigue, nausea, and vomiting. If left untreated, malaria can progress to severe illness. Severe malaria can be life-threatening. Symptoms of severe malaria include impaired consciousness, seizures, severe anemia, respiratory distress, and kidney failure. It is important to seek immediate medical attention if you experience any symptoms of malaria, especially if you have recently traveled to an area where malaria is prevalent. Early diagnosis and treatment are essential for preventing serious complications and death. Section 5. Unmasking the enemy. Diagnosing malaria. Accurately. Diagnosing malaria quickly and accurately is essential for effective treatment and management. There are several methods used to diagnose malaria. The most common methods are microscopy, which involves examining a blood sample under a microscope to look for the presence of Plasmodium parasites. It is the gold standard for malaria diagnosis. Rapid Diagnostic Tests, or RDTs, detect specific antigens produced by Plasmodium parasites in the blood. They provide results within minutes, making them suitable for use in remote areas with limited laboratory facilities. Polymerase chain reaction, or PCR, is a highly sensitive and specific test that can detect even small amounts of Plasmodium DNA in the blood. It is used to confirm the diagnosis of malaria and can also identify different species of Plasmodium parasites. The choice of diagnostic method depends on various factors, including the availability of resources, the severity of the suspected infection, and the need for species identification. Early and accurate diagnosis is crucial for timely initiation of treatment and improving patient outcomes. Section 6. Fighting back. Treatment and management of malaria. The treatment for malaria typically involves anti-malarial medications. These medications work by killing the Plasmodium parasites in the blood. The choice of anti-malarial medication depends on several factors, such as the species of Plasmodium parasite causing the infection, the severity of the disease, the patient's age, and pregnancy status. In uncomplicated cases of malaria, oral anti-malarial medications are usually effective. These medications are typically taken for several days. It is essential to complete the full course of treatment as prescribed, even if symptoms improve earlier. This helps to prevent the recurrence of infection and the development of drug resistance. Severe malaria requires hospitalization and intravenous anti-malarial medications. Patients with severe malaria may also require supportive care, including blood transfusions and assistance with breathing. Section 7. Shielding ourselves. Preventive measures against malaria. Preventing malaria is crucial. There are several effective preventive measures available. These measures include mosquito control, which involves reducing mosquito breeding sites, using insecticide-treated mosquito nets, and spraying insecticides indoors to kill mosquitoes. Prophylactic medication is advised for travelers to areas with malaria transmission. They should take anti-malarial medication before, during, and after their trip to prevent infection. The RTS S 01 vaccine is the world's first malaria vaccine and is currently being rolled out in several African countries. The vaccine provides partial protection against malaria in young children. By taking these preventive measures, individuals can significantly reduce their risk of contracting malaria. It is essential to consult with a healthcare professional before traveling to areas with malaria transmission to determine the most appropriate preventive measures.